Collin will talk to us about ophthalmology and diseases of the eye. Welcome Collin to the stage.
Since I was a little kid, I've always been intrigued by the human eye. Through your eyes, you perceive the world and everything around you. Now, if you know me, you would know that my dad is an eye doctor. That comes with many benefits such as in-house treatment for anything related to the eye, and it's also why I'm interested with this topic. Specifically, my dad is an ophthalmologist, defined by Merriam-Webster Dictionary as, quote, a branch of medical science dealing with the structure, functions, and diseases of the eye, end quote. In this speech, I will touch on the ocular diseases listed above, and I'll primarily talk about their surgical treatments. I will discuss refractive errors of the eye, cataracts, glaucoma, and corneal diseases. Before proceeding, I will need to review some ocular anatomy with you. The eye is much like a camera. The cornea is like the watch crystal of the eye. Not only is it clear, but it bends light. The iris, pupil, and the lens of the eye act much like the aperture and lens of a camera. The retina of the eye is much like the film of the camera. The macula of the eye is much like the image your camera is focused upon. Normal vision is when light is focused directly on the retina rather than in front or behind it. Farsightedness is when light is in focus behind the retina. Nearsightedness is when light is in focus in front of the retina. Astigmatism is when light is focused in such a way that there are two focal points, either both in front of the retina, both behind the retina, or one in front of and one behind the retina. To diagnose refractive errors of the eye, a Snellen visual acuity test is performed. Then a refraction is performed with a fluorometer to determine the presence of farsightedness, nearsightedness, or astigmatism. Treatment for these refractive errors includes glasses, contact lenses, or LASIK surgery. Glasses change the way light is focused before it enters the eye to reverse the abnormal refraction of the natural eye. Contact lenses do the same. LASIK surgery changes the curvature of the cornea to change the refraction of the cornea to bring light and focus precisely on the retina. LASIK surgery begins with the creation of a corneal flap by a femtosecond laser. The cornea is normally the thickness of a credit card, totaling 500 microns. The LASIK flap is 1/5 the thickness of the cornea, totaling 100 microns. The next step of LASIK surgery is the removal of corneal tissue by an excimer laser to change the shape of the cornea. The flap is then laid back into position, conforming to the new shape of the cornea. This procedure takes approximately 5 minutes per eye. Here's a picture of the eye after a femtosecond laser flap has been created and laid to the side. Next is a photo of an excimer laser ablation of the cornea once the flap has been laid to the side. This laser uses pulsed ablation to remove corneal tissue, thereby changing the shape of the cornea. The most common ocular disease is cataract. Cataracts are a clouding of the natural lens of the eye due to aging, UV light, or certain medications. Cataracts cause blurring of vision, specifically glare, which results from light scattered from the cataract. Cataract surgery involves the removal of the cloudy cataractus lens. The cataractus lens is replaced with a prosthetic intraocular lens. Phacoemulsification is the most modern way of removing cataracts. Phacoemulsification involves breaking the cataract up with a vibrating ultrasonic needle. Fragments of the cataract are then aspirated or vacuumed from the eye. The cataract is then replaced with a prosthetic artificial lens called an intraocular lens, an IOL. Intraocular lenses are either monofocal, toric, or multifocal. Monofocal lenses focus light at one focal point, either distance or near, at the patient's choice, eliminating the need for glasses or contacts at distance or near. Toric lenses correct astigmatism, bringing light from two focal points to one, eliminating the need for glasses or contacts at distance or near. Multifocal lenses focus light both distance and near, eliminating the need for glasses or contact lenses for both distance and near. Here's a picture of a monofocal intraocular lens. Next is a picture of a toric intraocular lens. The marks on a toric intraocular lens are located at the flat axis of curvature of the lens. Last is a picture of a multifocal intraocular lens. The rings on a multifocal intraocular lens function as a prism, creating two focal points, distance and near. Laser cataract surgery improves the precision and accuracy of cataract surgery by more precise placement of incision and by correcting corneal astigmatism. In laser cataract surgery, the femtosecond cataract laser creates a precise circular opening in the cataract, softens the center of the cataract, and then creates incisions in the cornea to correct corneal astigmatism. The second most common ocular disease is glaucoma. Glaucoma is a disease of the eye that causes elevated intraocular pressure. The eye is essentially a ball filled with fluid with normal pressure around 10 to 22 millimeters of mercury. This elevated intraocular pressure causes optic nerve damage, resulting in the loss of peripheral vision. In very severe cases, blindness can occur. Treatment of glaucoma is based on the severity of the disease. Patients are either treated with eye drops, laser, or surgery. The role of the optic nerve is to transmit visual impulses from the eye to the brain. Of the photos above, the top optic nerve image is that of a normal eye. The central white area of the optic nerve is 3/10 of the overall optic nerve diameter, which is normal. The bottom optic nerve image is that of an eye damaged by glaucoma. The central white area of the nerve is 9/10 of the overall optic nerve diameter, which is remarkably abnormal. Above is a photo of a normal and 3 glaucomatous visual fields. Visual field A is normal. Visual field B is mild glaucoma damage and is treated with eye drops. Visual field C is moderate glaucoma damage and is treated by laser or microincisional glaucoma surgery, otherwise known as MIGS. Visual field D is severe glaucoma damage and is treated by incisional surgery. Selective laser trabeculoplasty, or SLT, is one way to treat moderate glaucoma damage. SLT uses an argon wavelength laser to place low energy burns in the trabecular meshwork of the eye to increase fluid flow out of the eye. Approximately 100 laser pulses are sent to the interior of the eye through a mirrored lens. The other moderate glaucoma damage treatment is microincisional glaucoma surgery, or MIGS. In this procedure, an eye stent, a titanium stenting device, is placed into the trabecular meshwork to improve fluid flow. Here you can see that it is the size of a grain of sand. It is surgically placed into the trabecular meshwork of the eye, which is the brown band that runs 360 degrees around the interior of the eye. To treat severe cases of glaucoma damage, incisional glaucoma surgery is performed. A Varivelt glaucoma implant, or BGI, is made of barium impregnated silicone and is composed of 2 parts, the plate and the tube. The plate is sutured or sewn to the eye behind the extraocular muscles, and the tube is implanted into the interior of the eye. This allows fluid to flow from the interior of the eye through the tube under the plate, thereby lowering the pressure in the eye. Here is a picture of an implanted tube. After the BGI is implanted, fluid flows from the inside of the eye through the tube and under the plate to form a blister under the conjunctiva, the skin of the eye. This blister is called a blood, and the flow of fluid out of the eye reduces intraocular pressure. Last but not least is corneal disease. Loss of vision from corneal disease is due to opacities, better known as scars or swelling. Opacities of the cornea can result from trauma or infection, and swelling of the cornea results from either hereditary disease of the inner layer of the cornea or infection. Surgical repair of corneal disease is either a full-thickness corneal transplant, known as penetrating keratoplasty, or a partial-thickness corneal transplant, known as endothelial keratoplasty. The corneal ulcer shown above is from an infection from wearing contact lenses. This is unfortunate and could have been prevented by LASIK. After healing, a corneal scar will remain, reducing vision, requiring a full-thickness corneal transplant. A penetrating keratoplasty, or a full-thickness corneal transplant, is shown in the picture above. The upper left photo is a swollen cornea. The bottom right is a swollen cornea being removed. The bottom left is the cornea after the removal of the central section. The upper right is the human donor cornea sutured or sewn in place. Here is a picture of a healed penetrating keratoplasty. Endothelial keratoplasty, where a partial thickness corneal transplant places the inner layer of the cornea with a partial thickness human donor as shown in the picture. To perform an endothelial keratoplasty, the donor is rolled up, put into an injector, and pulled inside the eye by the forceps as shown in the upper photo. Next, an air bubble is placed inside the eye to make sure the donor cornea adheres to the patient's cornea. No sutures are used. Here's a photo of a healed endothelial keratoplasty. Now, after making you look at somewhat disturbing photos for the past few minutes, I'd first like to thank the faculty at Augusta Prep. I see many of them as great role models for the person I strive to be. Next, I would like to thank my parents, step-parents included as well. Without you guys, I wouldn't be where I am today. I'm glad that you have never ceased to encourage me, and I want you to know that I'm very thankful for everything that you do. Last but not least, the seniors. Keep your eyes protected and wide open so you can see everything in your bright future. Thank you.